If you're suffering from hair loss or worried about hair loss and are taking supplements or vitamins that are categorized as hair supplements, then this video is for you. So what are hair supplements? Hair supplements or hair complexes are a category of over-the-counter products that incorporate ingredients that are thought to promote hair growth or fight hair loss and are basically picked up generically over the counter for hair loss. Now in this video, we'll take a look at what exactly are hair supplements, what is included in those supplements, what are the ingredients or some of the ingredients that are included in those products, whether or not they have any benefit, and what should you do. For a broader discussion of hair supplements and hair loss, pick up a copy of my book, Sick Skin, Skincare Made Simple, right here on Amazon at the link below. And now let's get right to it. So-called hair supplements or hair complexes contain a variety of ingredients. Their usual suspects are biotin, vitamin D, zinc, iron, omega-3 fatty acids, saw palmetto, collagen. There's a number of other usual suspects. That being said, that's a pretty good list, a pretty decent length list of ingredients that are incorporated into these products. Now let's take a look at hair loss first. Hair loss, not too many people realize, is actually not one condition, but a staggering category of conditions that have multiple causes, multiple presentations, and in some cases can actually overlap on the same person. Now, the interesting thing is that they're caused by various factors, and no one hair loss is like the next. And no type of hair loss, one type of hair loss is caused by factors that cause another type of hair loss. So let's look at several types of hair loss, for example. Female pattern hair loss is nothing like lichen planopilaris. Lichen planopilaris is nothing like alopecia areata. Alopecia areata is nothing like CCCA or central centrifugal cicatricial alopecia. And all these hair loss kinds can lead to loss of hair, but they're not the same type of hair loss. They're not caused by the same factors. They won't respond to the same medications, and they need a completely different approach and a different time frame and different expectations to follow up on. So treating hair loss is a generic problem that can be supplemented for by a generic composition of ingredients is a little bit off the reservation, I'd say. I would not recommend this type of approach. If you find this video useful, share, like, and subscribe. Put a comment in the comments section. It'll help the algorithm, help other people find this video, find content like this, and support this channel. Now back to the video. Now regarding hair loss, interestingly enough, even with the correct diagnosis, treatment success is not a guarantee. Meaning you can come up with the correct diagnosis, female pattern hair loss for instance, prescribe first-line treatment for female pattern hair loss, and come up with nothing in certain cases, or come up with very disappointing results. And that means that you have to reevaluate your approach, and while you do have the correct diagnosis, that treatment did not necessarily fit your patient's needs, and you may need to switch around. Now, hair loss, treatment of hair loss usually takes anywhere from a few weeks, in the more speedy responding cases, to many months to sometimes even years. So you have to be right on top of things. You have to be right on the money to first of all have the correct diagnosis, give the correct treatment, and then follow up in the correct time frame to make sure you're meeting your expectations. And if not, you have to reevaluate your approach. So giving any sort of generic treatment to any hair loss would be a waste of time because we're not treating a specific diagnosis. We're not really giving a specific treatment, but a mishmash of treatments. So it's hard to determine what's heads and what's tails here, what's really making the difference, if anything is making the difference. And then the time frame gets a little blurry too, because every type of hair loss and every patient has their own time frame to follow. Now, interestingly enough, most types of hair loss are not associated with either nutritional deficiencies or hormonal imbalances. There are specific cases where vitamin D deficiency or iron deficiency or iron balance issues can contribute to certain types of hair loss, not all of them, mind you, but certain types of hair loss. And in those cases, the deficiencies have to be defined, determined through blood work, and treated specifically to make sure you're meeting and supplementing those deficiencies, making the patient whole. There are some issues where hormonal imbalances can contribute to hair loss. Again, not every hair loss, but certain types of hair loss But again, these cases are actually pretty rare. When they do occur, you have to address the hormonal imbalance and treat appropriately. That being said, again, no generic approach would be appropriate for hair loss. Generally, you have to really find out what are the underlying causes for the hair loss that you're treating. Now, as far as the efficacy of ingredients, individual ingredients in those hair formulas like saw palmetto, biotin, which is the most common ingredient, omega-3 fatty acids, zinc, iron, vitamin D, collagen, and any other supplement, you have to be very mindful of the fact that for most of those ingredients, there is very little evidence to support any use of those ingredients generically for hair loss, and even specifically for specific type of hair loss or for specific features of hair such as sheen or strength of the hair shaft. So all the ingredients that I listed so far, unless there is a specific deficiency in one of those ingredients, which is an extremely rare condition, the evidence supporting their use or their application to promote hair growth or to treat hair loss is actually very scant. There's very little evidence to support the use of any one of those ingredients. So I would suggest actually avoiding and skipping the hair supplements, certainly as a generic treatment for any hair loss broadly. Actually find out exactly what type of hair loss you have, find out what the underlying causes are if those can be determined, and then treat the hair loss appropriately to address the underlying causes and with treatments that have been proven and have a track record to help your hair loss and promote hair growth if possible. Go see a board-certified dermatologist who will help you do that thoroughly and effectively, fit you with the correct treatment and management plan, follow up in the correct time frame, and follow up with you should the results of the treatment not meet your expectation, so you can actually go back to the old drawing board and reconfigure the treatment again. Well, that sums it up for this video. Share, like, and subscribe. More great content coming your way right from this channel. Thanks for watching, and God bless.